Over-the-counter drugs, lecture 10. Over-the-counter drugs do not require clinical trial to prove their safety and efficacy. They can have harmful side effects, even though they are just over-the-counter and don't require a prescription. Starting off, we have some pain medication, pretty typical ones. We have acetaminophen, also known as Tylenol. And acetaminophen is for fever and pain. So it's an antipyretic and an anti-analgesic, or analgesic, whatever. If you overdose on acetaminophen, it can cause liver toxicity, and you're not supposed to take it with alcohol. Next, there is Nsaids, non-steroidal anti-inflammatory drugs, such as Motrin, Advil, naproxen, and Aleve. And they cover the same things as acetaminophen, the fever and the pain, but they also help with they're anti-inflammatory, whereas acetaminophen is not considered an anti-inflammatory drug. Nsaids are. Next, we have acetylsalicylic acid, also known as aspirin. And aspirin, just like the other ones, helps fever and pain. It also has the anti-inflammatory effect of the Nsaids, but not like the acetaminophen. And on top of that, it's also an antiplatelet drug. It is contraindicated in children with fever because of the risk of Ray's syndrome. Next, we have alpha adrenergic receptor agonists, such as phenylephrine and pseudoephedrine. And these alpha adrenergic receptor agonists are nasal decongestants, typically short term, 4 to 6 hours. And pseudoephedrine, is a behind-the-counter drug because apparently people are taking it and using it in meth labs and things like that. Some of the associated risks of this is, of course, since it's an alpha adrenergic receptor agonist, it's going to increase I guess kind of like the adrenaline, you can think of it, in the blood system. So it's going to increase your blood pressure. It's going to tighten things down, so you may have difficulty urinating. You may have insomnia or maybe some anxiety, and you're not supposed to use this for more than 3 days, because if you do, then your symptoms can actually rebound. Your body will kind of adjust to it, and then you'll get more nasal decongestion after 3 days than you had when you first started. Another drug here is triamcinolone acetonide, also sometimes known as Nasacort. This is also a nasal decongestion, but it works their different way. The other one was a alpha adrenergic receptor agonist. Triamcinolone is a glucocorticoid, and that means it's probably going to take a little bit longer to kick in, but it's also going to last longer, and you can use it for more than 3 days. But they do put some caution on using it for more than 2 weeks for some other reasons. And it does thin your nose, the tissue inside of your nose, and so you shouldn't be using it if you have sores in your nose and things like that. Next, we have antihistamines, and with antihistamines, they have both first and second generation antihistamines. The first generation antihistamines, things like Benadryl, can be a drug you're familiar with. These ones were, remember correctly, a little bit more lipophilic, which allowed them to penetrate through the blood-brain barrier a little bit more, which caused you to have some drowsiness. So first generation antihistamines cause some drowsiness, and whereas the second generation antihistamines, they made them so they did not pass through the blood-brain barrier as easily. Maybe they made a more polar molecule or something, and so you won't have the same kind of drowsiness with it. There might be drugs like Allertec or Zyrtec or things like that, if I remember correctly. But both of these are histamine 1 or H1 receptor antagonists, and they're for treating things like allergic rhinitis, so if you've got the runny, itchy nose and sore throat from allergies, or conjunctivitis, if the pollen gets in your eyes and makes your eyes all red and itchy, this can help with those symptoms. Next we have our, so these are H1 blockers, then we have our H2 blockers, and also proton pump inhibitors. And these ones are for treating heartburn. So they'll act on like the parietal cells of the stomach and help treat your heartburn, help your heartburn go down. There's other heartburn medications. The top one here, the H2 receptors, would be more long-term use, whereas more short-term heartburn would be calcium carbonate. Different ones, I think they used to have like aluminum carbonate, different things like that. Basically, this is like Tums, as you might think of. These are for only short-term use only. So maybe if you go out to a Mexican restaurant, you eat really spicy food, you know you're going to get some heartburn that night, and you start getting heartburn, you pop one of these, and it might take care of it. But it's not meant for long-term use, because if you keep using it, eventually your body's going to adjust, and it's going to produce more acid, and you're going to get acid rebound in your stomach. The next one here is Dextromethorphan, and Dextromethorphan, similar to codeine, but different kind of effects. It doesn't have any analgesic or pain suppressing effects, but it's a cough suppressant. And the way that it works is it affects your medulla oblongata, and it inhibits your threshold for coughing. And then there is, of course, sometimes they put some codeine in, guaifenesin, which is an NMD receptor effector, and it kind of has the same thing with the codeine in there does. And then lastly, we have Oxybutynin, which is a urine urge relief medicine. So if you have this urgency to urinate all the time, and it works by being an acetylcholine antagonist.